Guys, I'm back. This is Kimberly Purpose, and I had the video had cut off, so I had to re-upload. So more than likely, I'm going to have to edit this video. It didn't capture what I said. So, but I wanted to continue because I was talking about how the media is trying to make it appear that African Americans are the main ones that are getting the coronavirus. And it's strange how the coronavirus started in Asia and worked its way to Europe, and now it's in the United States, and it's very rampant. But and they want to keep this narrative going without having documentation or scientific evidence, statistical evidence to show proof that the African Americans, American Aborigines, are the ones that are getting the coronavirus. But it's from what I'm reading and researching, it appears that a lot of these false narratives are not correct. The reason why I brought this up was I wanted to show you how they're flooding the media with these false narratives of the coronavirus being affecting the African Americans. When originally, when the virus first came out, it was hitting Asia. A lot of gray Asians and gray Caucasians in Europe were dying out. And so it was attacking a lot of people, and a lot of people were dying. So, and you see it on the media, it reflects the face of who were the ones that were affected by this epidemic. But here in the United States, they're trying to paint a different narrative. And I also notice in China, they're doing the same thing. They're trying to shift the narrative off of them as the pale Asians and want to make the blame be of the Africans, when in actuality it's racist. Pretty much it's pure racism. And since they believe they have control over the media, they use that as a platform to try to shape and change the image of everything, even though it's not even the truth, or it's a fairy tale. And so I did want to mention China pushing the Africans out of China, trying to act like they the ones. I'm going, you all had the disease and brought it in, and it started with you all. Why are you trying? I don't know. It just doesn't make any sense. If anything, it'll make more sense for Africa to be pushing the Chinese out. But that, the Asian out because of the epidemic, because they're the ones that started and they fluctuated in their country. But, it just shows you how people are so fixated on this color system and how it's hard to move forward when this is the case. But I wanted to point out how there's still, I typed in which race is being affected by the coronavirus, and when I Google searched this is what came up. It showed African Americans. Here's other data, early data showing African Americans have contracted, and Black Americans face alarming rate of corona infection. See, they, instead of telling the truth, they gray. The grays are affected by this. They want to paint this narrative that it's the African Americans. And I believe they use it because it's frequencies. Like I said before, what you say and put into the universe is very important, and it's very powerful. And that's why we shouldn't just sit here and accept these false narratives without, there being any type of supporting data to support these things. And sort of like they're trying to make it be truthful when it's not. And if you don't have enough data to support what you're saying, you need to be keeping your mouth shut, especially the media. If you're not sure, 100% sure, and you don't have 100% accurate scientific evidence to support it, then why are you bringing out false narratives just because you want to paint this image and shift the blame on the indigenous Aborigines here in this country? But anyway, the title says Black Doctors Blissfully Woefully Anemic Data on Minority Coronavirus Cases. And the subtitles Incomplete Figures have made it more difficult to respond to the crisis in the neediest communities, which are majority minority. In other words, the grays, and the minority being the indigenous aborigines, the copper color races. The people like me. So when you go down here, this article was written by Maya King. Like I said, I'm not sure if I'm repeating myself because I'm starting anew with this, had to re-record this. But the preliminary data shows that minority patients are disproportionately at risk of being hospitalized with denied COVID-19. But health professionals says that the numbers have been released aren't telling the whole story. And it's not. And it says gross underreporting of tests, hospitalizations, and death related to COVID-19 was played with racial and ethnic data at the state and federal levels. Nearly half of all the states have not included any data on the race of ethnicities of those affected by the corona. Figures released by the Centers for Disease Control and Prevention on Friday list the race and ethnicity of 75% of all cases as unspecified. None of the race ethnicity statistics for deaths have been reported nationally. And see, this is what we have an issue with. These false narratives with these articles, I'm looking at it. You stroll down, you ask which race has been affected, and this is what you see, especially in American news. These false narratives. I'm going, how on earth can you shift the blame? And here, here's another one. African Americans are at higher risk. Trying to speak. It's like your evilness of trying to speak this negative downfall onto the indigenous people is horrible. It's like they put these negative talking points on the indigenous people as if we're the cause of it, or we're the ones that are affected by it. When in actuality, they're covering it up, and it's covering the grays instead. The pale race are the ones that are being affected, I believe, because it started in the Asia, near the gray Asians area, and then moved to Europe, where the gray Caucasians are at. And so if it's affecting them, then it would make sense to be affecting the same group of people here in the Americas mostly. So, and with them not reporting the races, I know it's that whenever they do any type of news coverage here in this particular country, they tend to hide the identity of things when it pertains to Caucasians. They don't mention a race. But when it comes to the indigenous Aboriginal people, the AKA African Americans, they want to categorize it as Black folks all the time and plaster that name on that and try to keep this false story going and painting this negative image and face to everything, when in actuality it's them that's doing it. Like the FBI statistical reports that reports the Caucasian being the main ones doing the crimes, but they show on the media a totally different picture, that you would think that mostly Blacks are committing most of the violent crimes, when in actuality is totally the opposite. And most of the crimes that the indigenous people do commit is due to poverty and economic poor, I guess, the not having as much resources available to them. And so it just doesn't make any sense. But like I said, I was just stating that only 75% of the cases, all is 75% that are unspecified. And I like how they highlighted that. And so it doesn't mention what race is being affected by it. And if they can't tell you exactly, how many people in each racial category is being affected, if they give you an exact number, then why are they flooding the media with these false narratives of the coronavirus only affecting the African Americans? So I'm going down here and we're going to move forward. It says here, the incomplete figures have made it more difficult to respond to the crisis in the neediest communities, which are majority minority advocates and health professionals of color. I'm recording. Color says the data, particularly released to test outcomes, is crucial to both treating the virus and stopping its spread in these communities. And the information that is available, we say, paints a grimmer picture of African American and Latinos, which are, the brown races, and who are already overly represented among the hospitalization of dead and majority states data sets. And says why COVID is hitting Black Americans harder. And see, here they're saying this because this is what they want to happen, and they're using the power of frequencies to do so. Hold on one second. Hold on, I'm trying to finish my recording. What are you doing? No more interruptions. Gotta edit this. But anyway, I gotta edit this again. I'm interrupting. But anyway, Kristen Clark, Executive Director of Lawyer Community for Civil Rights Under Laws, calls the CDC data astonishing at the federal government response to lawmakers' initial call for racial and ethnic data, woefully anemic. And I like how they use the word anemic. Anemic means to have low. They use that a lot. Anemic in the medical field. Like if a person has low iron, they use the word anemic to explain that the person has low iron in their blood, and they're usually considered to be anemic. And the way they are doing the data is very anemic. That means they have low data. And if you have low data and you don't have accurate numbers, it can also reduce, when you have low numbers, you won't have accurate, you don't have enough numbers to justify or quantify, I guess. That's the best term, to quantify the exact numbers or reading of what the outcome is. And so in statistics, you got to have a good number in your data set in order to get an accurate reading. And if you don't have enough numbers to represent, indicative of what you're researching, you're not going to have a good prediction of what the numbers actually are. And seeing that's the problem they have in this particular research. So when we go down here, I'm trying to remember where we are. And so pretty much numbers are definitely anemic. I have to agree with this, with the director that they speak of in this particular article is anemic. And then it says here the Department of Health and the Human Services has not offered a concrete plan how it intends to tackle the problem in front of us, Clark said during a press call on Monday. The fact is, they do not have race information tied to all their data. You know that our communities are being ravaged by COVID, and the federal government has a role to play. And see, this is another thing. It makes me wonder. They say the communities. Which communities are they ravaging? Are they speaking this into existence? Something they purposely doing? Because I know throughout American history there has been a history of them exposing the indigenous people to toxins in order to push a narrative, I guess. Like with germ warfare and everything, they did that when they colonized the Americas here by introducing the people to smallpox. They knew smallpox was very deadly, and so what they did to make sure that the indigenous people were exposed to it is something else that they're doing, another hidden agenda. Crack epidemic is another thing they did to the indigenous Aborigines here in the Americas. They implanted it. The Tuskegee Project is another example. It's a lot of examples if you read through that this has been done. So it makes you wonder, does the government do have a role to play in it? And they speaking into the media is something that they're purposely doing. And then it says here, Clark calls the Health and Human Services to release the data on testing and test outcomes by race. So far, only 2 states, Kansas and Illinois, made public the tests broke down to race and ethnicity. Half of the United States have released some racial and ethnic data outlining deaths from COVID-19, and 34 states have recorded cases. So how can they, like I said again, flood the media with this false narrative that's mostly affecting African Americans, American Aboriginals? How can you say that it's affecting the indigenous people here? Flood the media when it's quite obvious and quite evident that they haven't, most of the states haven't recorded which ethnic group has not done a thorough analysis or has actually reported these numbers. So if they're not reporting the numbers of and identifying who the races are, then what are they hiding? And why is the media giving false stories as to who has and who's not, and why they are shifting the blame on the indigenous people when it's not warranted, when you don't have this facts? So it says here in Kansas, African Americans comprise less than 6% of the state population, but make up 15% of the positive cases and 32% of deaths, according to the data related by State Health Department on Monday. Nearly 400 of the 1,705 killed cases are listed as unknown racial ethnic identity. So that's still a lot of people, 400 cases. And so they don't know what ethnicity it is. And then a similar patterns emerge in Georgia. The race and ethnicity is 47% of the state are unknown. African Americans make 24.7% remaining cases of the remaining cases, and 54% of all the deaths, more than any other racial ethnic group in the state. And see, unless they're recording how many blacks are dying and just not recording the Caucasians. And I don't know if they're trying to hide the fact that Caucasians are dying too, or they're purposely infecting the indigenous people with this coronavirus, or it's 2 things, because it's very fishy to me. I'm going, either they're trying to speak and use frequencies. This is something else I believe. I know they are, because they're flooding the media with false narratives. If you don't know things for facts, then you don't put it in. Or they know something and already saying it because they know it's already happening. Or It's or they know that Caucasians are dying too, and they just don't want to report them, which I think is happening because so many of them died in Europe. So why are you showing the Caucasians dying here? And I think the reason why is because they don't want you to know that they're dying too. Because they cover up crimes when Caucasians do things wrong. They cover it up. They don't never put